Well, certainly, I think the doctor that you're referencing certainly needs to take your history into account because, as we've talked about in this room, and as is evidenced by the science of PCOS, is PCOS can evolve over time. And of course, if people take active steps toward addressing their personalized health issues, they can reverse many of their PCOS symptoms, or lab tests can improve that can give the impression to the eye looking at it in the moment saying, oh, I don't see evidence on lab testing. But that's why the Rotterdam criteria literally has the words history of, because that's important. So I'm not sure if this particular clinician that you're talking about is aware of the importance of taking history into account. Certainly, if you were seeing me, I would actually request the records from prior doctors, but also what's really inferred in the Rotterdam criteria is the importance of your medical history. And so if your medical history and your menstrual history is indeed history of irregular periods, if you indeed have the history that's very supportive of the evidence of androgen excess, if you've had prior ultrasounds that show polycystic appearing ovaries, taken together, that can help clinch your diagnosis. And it's important to know the diagnosis because, in so much as you may have reversed it, have things looking great on lab tests today, it's important to know because we have to do special tests to make sure you're truly well controlled. For example, as I've described in this room multiple times, a person who has PCOS with metabolic syndrome. Metabolic syndrome can manifest with either high blood pressure, insulin resistance, but insulin resistance is a tricky one because, in fact, when you have insulin resistance and a still healthy pancreas, your pancreas will rise to the occasion and make enough insulin to keep your blood sugars appearing normal on traditional blood sugar testing. And so, what we actually have to do in that context is not just test a hemoglobin A1C to look for your A1C, but to look actually at how your pancreas responds to a glucose load, which is known as a glucose tolerance test, which is we give you 75 grams of glucose, and then over the course of 2 hours, we draw blood every 30 minutes to see what are your glucose levels to show us the rate at which you break it down or clear it from your bloodstream, and how much insulin is being required to do that clearance, which is known as insulin response. And so I am not sure yet if your current clinician is still doing the full scope of what's needed, which is taking your history into account, doing the due diligence to request the prior records. That's really important because it can give you a false sense also of, oh, I was misdiagnosed. But if in fact things are normal now because you've taken active steps, if you start reversing those steps, let's say you've been careful and watching your carbohydrate intake, you've been careful and doing all the right exercises to keep your muscles working to help keep you sensitized to insulin, etc. I can see that working against you by you falling off the wagon and actually having suddenly showing up in a year or two with everything disordered. And then suddenly the doctor's like, well, what happened? You were fine 2 years ago. But it's because of that little small detail of not taking your history into account and applying it. So, what I would say is follow up, perhaps request those records from that endocrinologist, even if that doctor has since left their office. There should be a way for you to still get your health records. And I would either go back to your doctor and say, I just wanted to make sure we're actively looking at the whole picture. Or you can also seek a second opinion. Doctors like myself do virtual appointments. We do video medicine appointments, and you can request a video appointment to review your records and to talk about a plan. I currently have PCOS patients that I see from across the United States. I literally have patients who are based in New York, patients in Florida. I have patients in the Caribbean. I have a patient in South Africa. We have patients around the world, really. And so that would be some of my suggestion